I think there was a misconception for Medicaid patients that they would not engage within this virtual care setting. And they have been one of the top utilizers of our services. Almost everybody has a smartphone now. And that is a requirement. We do almost exclusively video visits. But I think really for MetroHealth, a lot of that had been telephonic. And for us, we really stressed the importance of being able to see that patient and connect with the patient.
Welcome, MedTech Gurus. Today, as I mentioned in the introduction, we're joined by an extraordinary leader who is helping reshape the future of care delivery. Michael Dalton, CEO of Ovatient. Michael brings a rare combination of entrepreneurial vision and deep operational experience within major healthcare systems. Before co-founding Ovatient, he served as the entrepreneur in residence at the MetroHealth system, where he focused on scaling innovative, value-based care models for underserved populations. His career spans roles in strategy, innovation, and digital health transformation, all with a core mission to make healthcare more accessible, equitable, and sustainable. Now at the helm of Ovatient, a virtual first care company built by health systems for health systems, Michael is leading a movement away from transactional telehealth and towards integrated longitudinal care that meets people where they are. Hey, Michael, are you ready to be our guru today?
I am. Thank you very much for having me, Tom.
We're excited to have you. So we'd like to start out by just telling us something fun or interesting about yourself or your family so we can get to know you a little better.
I think one thing that I think is pretty fun, I'm an avid Guardians fan. So whether you call them the Indians or the Guardians, I love baseball, grew up playing it. And it's just been a passion of mine, something I got to grow up watching with my dad, being able to participate in throughout high school. And a lot of times here, while I'm working, I'm listening to the Guardians, still on the radio, 1100 WTAM. I'm listening to the Guardians and Tom Hamilton, and that's just one of my favorite pastimes of being able to listen to them.
Yeah, I love it. Baseball is great. I enjoyed, but I have to tell you, I happen to be a Detroit Tigers fan, so we might have to do some arm wrestling or something later on.
We're chasing you. We're only 6 games back, Tom.
No, right? It's
only
getting close.
6 games back.
It's been a good season, so that's funny. So, Michael, you had a role, first of all, as entrepreneur in residence at the MetroHealth systems. So, right. which is a great system. And I'm just wondering, what were your top 2 or 3 leadership lessons you took away from this role that really helped guide you as a CEO of a fast-moving health tech company? Can you provide us any insights with that?
Yes, absolutely. So I think a couple of the things that really stood out to me is that in moving into the space for virtual care and digital health, this was not something that there was a lot of expertise in the health system. And what I needed to do is really help listen first, understand what was some of the pain points, being able to, and that's one of the key things, was just listening and understanding what are they comfortable with. How my background is actually in positive organizational development and change management. And thinking about how we are going to incorporate new models of care that really flip how care has been delivered for the last 100 years, and in thinking about where that patient begins and how do we get them to the care that they need where they are at. That listening was key to being able to build trust with them, understanding what they felt, what they understood, we always led with this notion of, trust is everything, because for them to be able to trust in our care model and what we're going to be delivering from a virtual perspective, whether it was hospital in the home, we created a virtual maternity care program. It created just a real importance to be able to listen first and foremost. I think also for me, I've always been, one of my values, one of my strengths is being persistent. Oftentimes I heard, no, we can't do that. We haven't done it that way. And it's still needing to really be able to respond in a way that I wasn't going to do something to someone. We're going to co-create it and also help create the table in which we created governance to bring together those kind of multifactorial resources. And so I was able to honor the fact that oftentimes in health systems, things they can move slowly. But and with good governance though, and having that in place, we were able to make progress, create a table where people could provide input, feedback, insights, but we were still going to keep moving forward. We had a clear vision. People understood what that vision was, and we could then share with them the outcomes that we were creating and why we needed to do this from within, and why Ovation was so important as we continued to build it as a company and as a care model at MetroHealth.
Yeah, that's really helpful. And there's a couple things I wanted to touch on. And first of all, the persistence part, right? Because, as you're working with an innovative company like this, people don't always get it the first try, right? I mean, they don't
Yeah.
fully understand maybe what you're talking about. And I think that listening comes into it, but it's that gentle persistence, right? Of kind of coming back, listening, coming back, listening. Am I on the right track with that?
Absolutely. And I think, I was fortunate in that I had built a lot of trust at Metro Health. So it allowed me to be that entrepreneur in residence. I think if I had come out from the outside in, people would have been an unknown factor. And there would be a lot of time spent to building that trusted relationship. So I appreciate the opportunity that I had. This actually was a new role for Metro Health. It hadn't been created before. And so this notion of being able to I wouldn't say disrupt, but being able to discover from within, understand what some of those pain points, and then create the product that met the market need and really helped overcome some of the struggles and barriers that I think Metro Health was facing. But they're focused on what's the work that's in front of them. And for me, I was able to say, okay, but where do we need to go? And I had great mentors, great leaders. I think that's one thing too, is having champions and being engaged with them. They really advocated for me, and it was built on and what I was doing. And they had a strong belief in a shared vision that we had for what virtual first care, what a care delivery model could be. So I do appreciate that. I would add just having strong champions who advocated for me and for what we were doing.
Yeah, for sure. And you also used one of my favorite words, that being trust, right? I work with a lot of healthcare innovators in my consulting role. And, it's that trust doesn't come overnight, right? I think sometimes we think, well, we've got this new innovation and people should just flock to us. But you've got to build that trust over time, right? And they've got to understand and learn and work with you. And you've got to be patient to build that trust, correct?
Absolutely. So I always I love using this analogy of um, we are not the Federal Reserve. Trust is finite. I cannot print more trust. That is something that it is. It's a commodity. It is something that you can. It's really difficult. Once you've lost that trust, you're not going to get that back. So it is something that we take very seriously. I think that's part of why our model and why we led, Tom, is just being built on Epic. One of the first things I always heard in being that entrepreneur in residence was, how does this integrate with Epic? How does it integrate with my workflow? Because that helped, build and maintain trust as well, is because I wasn't creating a disruption. I wasn't creating a distraction. And so I think that's something that helps really build trust as well. Again, back to the listening piece and knowing that if something was shared with me, I was going to follow back up. I was going to tell them if we couldn't do it, why. That's just as important as well, as to say, we're not going to be able to do this, but we can do this. And here's where we're going to go. And I think that was really important.
Yeah, I love that. And I actually wrote down, we are not the Federal Reserve. I'm going to use that one day. I love that for sure. And I want to build on something else that you mentioned, right? So, if you will, I'm going to, you're kind of a health system native, right? I mean, you started inside, right? So I'm just kind of curious, from, working inside the health system, how did that help shape your strategy from other med tech companies? Do you think you did anything differently? And if so, what?
Yeah, I think what I really understood was how decisions were being made when it came to IT investments, informatics, how they were participating. I knew what an integration looked like at a health system. And it's not always easy. And oftentimes, I think for digital health companies, integrating with a health system is one of the last things they do, is because it's somewhat foreign. And for me, I'm like, this is actually an area that I know well. It's a strength. I had the trust of MetroHealth to be able then to do that integration and to build that out. And then moreover, I had that trust from MUSC and both health systems being, and it hasn't been easy, Tom. I think that's the piece, but it's knowing from the inside out how we were going to be able to help navigate this, where some of the blockers might be, where there's a forum, where we anticipate some of the questions that are going to come. How do we address them and get ahead of it? Because I've been in those very boardrooms, those very meetings, and just thinking about how can I respect the decision-making process, get ahead of it, provide the answer, and continue to move forward. And so I think too, as I was alluding to earlier, is just being built on Epic, understanding the intricacies of my chart, where Epic is going. I think that really helped shape us in a way that then as we're talking with our partners, we're speaking their language. And that I think is important as well. So I think too, when you look at specific like factors that we're not just looking at creating access for the sake of access, or you're having a visit and we are being measured in the experience we provide. We're being measured in the access we create, but it's access to high quality care and the outcomes that we're creating. And also some of the new patient populations that we're creating access for at MetroHealth. So our patient population is twice the amount in terms of a commercial rate. They have new commercial payers that they haven't seen as much penetration in the market, but their patients are utilizing, or their members are utilizing our services. So I do think really being able to speak that language has been critical for us being successful both at MetroHealth and MUSC, and also for our future customers that we're talking to. They see us as being a partner, Tom, not just a vendor. Yeah. And that's actually helping us, open doors and secure deals, is because they've literally said, we see you as being a partner, not another vendor. And as we explore this space together, we know that you're going to be there with us because you've been on the inside and you know that.
Yeah, and I want to get into that partnership in just a moment. But before we go there, maybe just take a moment. You're sitting. You're working at MetroHealth. You're the entrepreneur in residence. Tell us a little bit about the story about what inspired the formation of Ovatient. How what was the impetus that got that going?
I like to tell the story that what was a virtual care strategy became a virtual care company. Mm-hmm. So I set out it was not to create a new company. It was really that we had put together a number of programs, projects, and implemented them. And these were things that had been on the shelf in preparation for being able to launch over a period of time. But with COVID, then these programs like hospital in the home, chronic disease management, and virtual remote patient monitoring, these were programs that we had to quickly roll out, a large-scale virtual urgent care product. And what we needed to go back then is to say, all right, how are we going to right-size, level set, understand really what the right mix will be for virtual care and in-person, and how do we create a better connectedness for that patient journey? And as we went along this path, it was a realization that for me in that position, I was always trying to integrate a new product, a new solution into Epic. So instead we said, what if we build a practice and we could do this on behalf of small to medium-sized health systems where resources are stretched. There may not be that expertise. And oftentimes they're competing against the largest player in the market. And so our target really is helping that second, third health system in there who maybe can't create an N of 1 experience. We're creating an N of 20. That's what I like to call it, is that we're going to create what I call a digital health home. We're going to create these services, this experience, and we can bring this to you, for you, leveraging the expertise that we have, having worked in the health system. And that's where we evolved. That's how we got to it, is to say, I'm going through this exact same experience, and I bet you there's chief strategy officers, vice presidents of virtual care, somebody leading ambulatory services at a health system. They're going through this exact same pain point. How can I come alongside them and help them with solving this issue that I'm working on today?
Yeah. Yeah, that's helpful. But and I'm curious, right? Because we talked a little bit about trust, and you mentioned MetroHealth and MUSC. So maybe for our gurus out there that are soon to be entrepreneurs or early stage entrepreneurs, how did you go about building a partnership and trust with two large health systems like this to co-develop rather than compete with each other? Do you have any tips or tidbits for us there?
I think one of the key components was that there was a relationship between leadership, and that transcended. It really transcended geography. So you have MetroHealth, MUC; they're not competitors. So that opportunity of one, we wanted to say, and I take a strength-based approach. MetroHealth, first public hospital or public health system ever on Epic. They're now at 26 years. Great informatics and IS expertise. MUSC, National Center for Telehealth. And so I looked at it from what their strengths were and where the opportunity was, as well as some of the progress and initiatives that Center for Telehealth at MUSC has garnered. And they have a great reputation, especially in the Southeast, for what they've been able to do. So as we talked about it, and what was, I think, unique, is we looked at their strengths, but also then what some of their limitations were. Both being public hospitals and health systems, they were going to be restricted from an innovation lens to really what their mission was, and that was to serve the people of South Carolina or to serve the people of Northeast Ohio. But they were making this investment in innovation, and they were leveraging their expertise to then be a transformative product to say, okay, great, we have this virtual first model that respects and honors us as health systems, meets our needs, and provides care continuity. Let's take this beyond our boundaries. And that's what I think really was a shared vision that the two health system leaders had. And I mean, there's Dr. Cawley at MUSC, an incredible leader, a credible reputation, and he gets stuff done. And while there has been some change in the CEO leadership, I've been really at MetroHealth over the last few years. I've been really fortunate for executive leadership, like from Dr. Nabil Shahadi, who has really been a partner there, as well as their chief operating officer. So I always had that executive leadership and sponsorship and partnership and that belief in what we were doing. And I've been really fortunate to have that.
Yeah, yeah. So, Michael, with that, and it sounds like you really a powerful platform, right, and a partnership. Maybe you can give us a real world example of what that's meant, in terms of what it's doing for your patient population and what the company is doing, and how you're getting out there and building this experience for patients and the systems.
The real world impact, I think, for MetroHealth, our first year, so we launched last April of 2024. We saw over 28,000 patients in the first year. With MUSC now coming on board in the last couple months, Tom, we expect to see almost 100,000 patients for our virtual urgent, primary care, and behavioral health product. In the real world impact, and I love the patient stories that I get to hear from my providers, is that for too long, I think patients, they've kind of had to be, they haven't necessarily had the agency or the ability to say, this is how I want to receive the care, still high quality, how I want to receive the care that I need when I need it. And also being able to understand there's some white coat syndrome that's absolutely is out there. When that patient has to be able to come to an in-person brick and mortar, they're waiting in the waiting room, they're not in the comfort of their home. The stories that I hear of patients being dismissed, not at MetroHealth, but at other health systems or other, for MUSC, it's not at MUSC. It may be another place in the community. And finally having a place where they feel comfortable to share their stories, share what's going on. We had a great patient case where, unfortunately, this patient, she had been bounced around in primary care clinics for about 3 years. She finally came to Ovatient. We were able to provide an environment where she could tell her story. We listened to her. And unfortunately, we found out that she had lupus. We got testing done. We got her, came back with that diagnosis, but got her connected to a rheumatologist within 1 week and was able to then start that plan. And so I think when I think about real world impact, we're also reducing barriers to care, where for patients, it's really the click of a button. They're very comfortable with my chart. We're not creating a different experience that they have to somehow navigate. At MetroHealth, especially, there's a lot of my chart activation, and they're using what they know. They're getting the care where they're comfortable and what they know, and they're engaging. Our net promoter score is at over the last quarter, Tom, has been at an 87. And
Wow.
so, and that goes, across all payers. It's just been something that I was expecting there would be a demand for it, but you know, just getting to see the feedback from patients, how they appreciate the care that they're getting, and the difference that they're experiencing. That's been something that's meant a lot to, I think, to me and to our providers. So I think some other real world impact too, just that we're able to create, is around our whole person care model. And so patients who are coming in, they may have a primary care need, but there's a behavioral health obstacle. And so, I've seen, we've done close to 1,000 integrated behavioral health visits. This is an area of opportunity for us as part of our whole person care model, is that so many times the obstacles to achieving improvements in physical health have to do with behavioral health conditions. And just being able to see patients who, as part of their weight loss journey, there's anxiety about what might come with that. And being able to bring a behavioral health provider in, support them in that, help them. Sometimes it's addressing their diet. Sometimes it's just answering questions that they have about trauma that they've experienced that's creating a barrier. So I think from the real world impact, net promoter score, the quality, the appreciation for the care model, and making sure that we're taking care of all the needs of our patients.
Yeah, it's fascinating, and I might put you a little bit on the spot with this, but I apologize. But I'm thinking, as I think of in northeastern Ohio, the greater Cleveland area, and that whole, really the state of Ohio, it's really complex, right? You got huge urban settings, rural areas, right, and really the same for the South Carolina, right? And I'm thinking, with the time and distance and complexity of just, where the various patients are coming from, both a distance and from, their whole community experience, I would think it's got to be really eye-opening for your practitioners to all of a sudden getting the ability to connect some of these dots that they might not have been able to do in the past. Am I head down the right path with that?
I don't know if you read our vision statement, but we actually talk about how time and distance are no longer barriers to being able to achieve, phenomenal care outcomes. So you are spot on in what we're able to deliver to the patient. And I would say those barriers, though, exist whether that patient is urban or rural. Because for sometimes it's more a matter of, I don't have transportation, or the transportation I have it's going to take me too long to be able to get to that appointment, and I can't fit that into my life. We're taking that away. We also provide extended hours. So our primary care, you can see a patient at 7 a.m. to 7 p.m., including our behavioral health service, or for that same day care appointment, we have 7 a.m. to 10 p.m. Monday through Sunday. So that's when we say time and distance, I think is so important. And respecting that for a lot of patients, being able to be seen between 8 and 5, that's part of their workday. Or they're taking care of kids, they're putting them down to bed until maybe 8 o'clock at night. And the one time that they might be able to have to connect with a provider might be after 8. And they might have an item that they're concerned about. Let's start that care journey. And that's the one thing I'd love to stress is even getting that same day or urgent care appointment, I still see it as primary care. Our team still sees this as primary care. We're taking care of an acute need. We're listening to what you need. And if you need more, we'll get you connected to a primary care provider, whether it's at Ovatient or one of our customers or other resources in the community. So that's something that I really think is a distinction for us. I do like to call it's virtual first, local always. It's just making sure that we're able to help be that navigator for that patient once we've built that trust, have the relationship with them, how to visit with them. That is something we take really seriously about then getting you to the next level of care or having you come back to Ovation.
Yeah, that's phenomenal. And, I want to dig into it just a little deeper, if I might, too, because as I think of digital health, many of the players that I'm aware of are really urgent care only types of models. And,
Yeah.
and I'm wondering if you can help us understand why that isn't enough, and maybe what does Ovation do differently to deliver this continuity and really kind of complexity in a virtual care. Can you help us understand that a little better?
Yes. So I do think, and it is meant to, urgent care often on many platforms is episodic. And for us, it is about, that's just the first step in your care journey. So if that patient, and what we see is whether you need primary care, urgent care, it's care. So we're going to provide you the same high quality visit. We're going to listen to what's most important, and we're going to help you then move along that journey. And the beauty for us is being on Epic and being able to share information across the medical record through Care Everywhere functionality that's in Epic. We can message, with the provider, we can message at the health system and the community, and we're able to care for that patient. And that's why I think from urgent care, it's a place in time, but for us, we're looking at a longitudinal care path for that patient. And for many of them, they've not engaged with primary care before. Our patient population is between 24 I'd say 24 to 49. That's the right now that's the market that's largely selected us to be their provider. And I think what we're starting here is for patients, that's the way that they prefer to be cared for. And then we're going to see them continue to engage in that way. And that's our vision, is that we think increasingly for health systems and for patients, this is the way that patients will be getting the care that they need. And so being able to, and this is, I think, another key factor. When we look to hire providers, we look for those who already have experience in the health system, and have done both in-person and virtual care, because that allows them to understand what are some of the challenges. Same with our nurses, our MAs, or behavioral health team. We want them to understand what that patient journey looks like today, because we know there's going to be some level of translation. But at the same time, then we can think about how do we redesign that. If we don't know what it looks like today, you're not going to be able to redesign it for what it needs to look like tomorrow. Mm-hmm. So that's why I think this notion, urgent care, fine place to start your care journey, but it should not be episodic. And what we are doing is then putting care delivery and care pieces around that entire model, whether at Ovation or our health system customers, to meet the needs of our patients.
Yeah, and I would think that you're getting ahead of a lot of issues that might create that episodic care, right? And maybe cutting it off at the pass, if you would.
Yes, I think that in establishing that primary care, and this is, I love to hear the stories from my providers. We do have some patients that they use urgent care as their primary care, and that's what they're comfortable with. They want it on demand. They want it where they want that visit in the comfort of their home. And then we introduce the concept. Hey, we've seen you a couple times. Have you thought about establishing with primary care? We can do this. We could have the same visit, but you'll have the same type of visit, but with a consistent provider that you'll be able to connect, and they'll be able to care for you over time. And I've never heard somebody say, no, I don't want a primary care provider. They just don't understand that this notion, this model. And I know that's hard to believe. I mean, for me, I grew up going to my primary care doctor. But in this generation, that's just something that's not always a priority. And so I think meeting that patient where they're at, I know it's become a little cliche, but that's truly what we're doing, is saying, okay, we've started you here. Let's suggest this. We've built trust with you. You've liked this model. We think we can do more for you by providing that virtual primary care.
Yeah, interesting. So I'm wondering also if you can help us out too, because one of the more challenging populations, the Medicaid population, that I know your team works with quite extensively. What's been one of the more surprising or challenging aspects of scaling care for a Medicaid population? Can you provide us some insights there?
I think there was a misconception that for Medicaid patients, that they would not engage or within this virtual care setting, and they have been one of the top utilizers of our services. So I think there was maybe a misperception that from a digital literacy perspective that they wouldn't be able to engage, or would they have access to the internet. almost everybody has a smartphone now. And that is a requirement. We do almost exclusively video visits. And I think for MetroHealth, to some degree MUSC, they've really specialized a lot in asynchronous care.
Mhm.
But I think really for MetroHealth, a lot of that had been telephonic, audio only visits. And for us, we really stressed the importance of being able to see that patient um, uh, and connect with the patient. And so we've had, almost universal adoption. It's not been a barrier. And where it has, maybe that patient um, needs to be seen in person, we've actually created access because patients who typically, maybe they like virtual care, but they've been having to be seen in person, we've now created openings for them. I think the one challenge that I will say, and it's more about maybe what we're anticipating, Tom, is we increasingly are seeing patients who were covered by Medicaid, they're losing coverage. And we're seeing that churn. So we do provide, and this is the nice thing that if you're in network at one of our health systems, you're in network at Ovatient. That's one of the unique components of our model is that we end up routing those charges to the health system that we work with. They drop the bill, but if they're in network, they're covered by their health plan. But if they're not, our health system partners, we've worked with them to come up with what we think is a market rate and what's an affordable cash option. So I think increasingly that is going to be something that's going to be a challenge. We're going to see this churn, and patients who maybe had enjoyed coverage are going to lose it. And we are looking, and more to come, but we're working on how do we help remind patients about maintaining their coverage. We're working with the patient financial service at MetroHealth. We'll be doing the same with MUSC, just to make sure that patients understand the benefits that they have and the coverage that they need. But again, if they've lost it, we stand at the ready to be able to provide a convenient cash option for them.
That's really first of all, I think that's very innovative, and I hope I don't oversimplify this, but it seems that by doing that, you're offering that primary care benefit, if you will, or that advantage, because I'm thinking that patient, if they didn't have this access that Ovation provides them, they would still show up at urgent care or the emergency room, right? Where it's still, probably the highest end of providing that kind of care. So in the long run, it sounds like maybe it's a win-win. Is that correct?
Yes, and I think what we've seen and we've heard from health systems across the country is charity care is growing. It's escalating. And so instead of having that patient go to the emergency room and incur a large bill that they probably, one, they didn't need to get the care there in the emergency room, we can provide that to them either through a virtual urgent care visit or a virtual primary care appointment. Through that affordable option, we're providing the right place. We're avoiding bad debt. I just think that's a better model for a patient. No one wants to wait in the ED either. Or, if they can, if we can care for them at home, that's what they're going to prefer anyways.
Yeah, for sure. For anybody that has had an emergency room visit, we all know what that wait can be like. So for sure.
No,
So
thank you.
Michael, yeah, this really seems like an exciting time for you and your team at Ovation. What's next? Where are you and your team going from here?
So I think we launched today. We expanded a remote monitoring and chronic disease management program for all of our patients. So we're partnering with Care Simple, who's a remote monitoring company, as well as with MetroHealth. And we're providing remote patient monitoring and virtual chronic disease management services. We're scaling with our customers. And I don't want to underestimate that. Oftentimes I think, when I get that question, they're looking like the next big thing. Next big thing for me is providing a successful experience for our customers. They put their trust in me, and we want to deliver on what we promised. And so that's really in terms of hitting the volume, the quality, the experience goals that we've set out. And so that there's a lot of work that goes into that. And I hold that really dearly. I stay on track of those numbers, seeing where we're at. I think another area that I'm excited about is that we have an experience called My Care Anywhere. We've partnered with a company called League. They're a digital consumer experience company. And we're taking this experience that we have, and we're bringing it on behalf of our MetroHealth customers and then also other health system customers. we're going to be bringing that for them to employers and their employees. What we want is when an employee is looking for care, that they're coming to their trusted health system. They have a digital experience that they prefer, and we're looking at how do we continue to bring that patient back who they may not have an affinity necessarily with the health system. They have it through the employer and their coverage, but we want to help keep MetroHealth, MUSC, our next customers top of mind when that employee is looking for care. So I'm really excited to see where we go with My Care Anywhere and our partnership with League. And I'll just say I'm looking forward to later this year onboarding our next customer. So the plate is full. I think by the end of the year, we'll be at over 50 employees. And that is really driven by our clinical team. And so I'm really, and those are all, I would just want to stress, all W-2s. They're all part of one team that are working together to serve our patients, to serve our customers. And so I think that's something that I take a lot of pride. We're getting ready to celebrate our second anniversary as well. And to celebrate. This is a tough time for digital health and virtual care companies. And I don't take that lightly that, we were able to continue to grow, and we're going to celebrate that second anniversary at the end of this month.
Oh, that's fantastic. And enjoy that celebration. It sounds well-deserved. So, Michael, first of all, I'd like to just thank and acknowledge you for being our guru today and all the terrific insights that you brought. If somebody wants to learn a little bit more about you and your team at Ovatient, is there a website? Are you on LinkedIn? How do we find out more?
Ovatient.com, our LinkedIn presence. We have a phenomenal LinkedIn. I don't know how many people on your show talk about that, but we really use that as a place of engagement with the healthcare community. Some of our biggest champions are our employees that are promoting Ovatient, as well as our customers. The followers that we have there have grown astronomically. And also, I would say, check out mycareanywhere.org. So Ovatient.com, mycareanywhere.org, as well as the Ovatient LinkedIn. You'll get our regular updates, content that we're sharing. We make it relevant. And I think one of our taglines is virtual care that's entirely human. We tell the stories of our employees as well as our patients and the impact that we can make together.
Oh, that's fantastic. So, Michael, once again, thank you so much. I enjoyed our conversation and the insights that you brought as our guru today.
Thank you for the opportunity, Tom.
Thank you. Thank you for listening to MedTech Gurus. I am Sylvester Harris, your MC. If you want to learn more about Tom and his consulting services, you can go to www.pctmedical.com or email Tom at tom@pctmedical.com. Now, I can be reached at Sylvester Harris, that's SylvesterHarris 5048@gmail.com, and I'd be pleased to discuss any voiceover work that you may want for your company or broadcast. Hey, thanks so much for listening, and catch us on the next episode of MedTech Gurus.